we have been open and transparent with Canadians on the facts, and I've said from the very beginning that there are a wide range of scenarios that we have been looking for, that we're planning for, that we are trying to work towards as a government, as a country. We know that we are going to be in place for a number of more weeks, perhaps more months, but everything depends on how Canadians behave. The choices you make to stay at home, to self-isolate, to not go to 6 different stores when you go grocery shopping, to try to go grocery shopping only once a week, to be very careful to keep those 2 meters apart when you go for a walk, if you're allowed to go for a walk. These sorts of things are what will arrest the spread and the increase of this virus. We need all of us to do the best we can to make it through this unprecedented situation, and that's exactly what Canadians are doing.
I'll start, Alex. Thanks for the question, and then I'll turn over to Dr. Tam for some specifics. That's the work we're doing right now, is some modeling work in terms of what we could anticipate given various measures that have been taken across the country by various provinces and local municipalities, as well as federal government actions. It's not as easy of an answer as I think it would seem, in that different ranges can be anticipated in different ways depending on the measures that have been taken, the effectiveness of those measures, when they've been taken, etc. So I'll tell all that to say that that is top of mind for us in terms of what we're doing at Health, because not only does it give us a way to accurately or more accurately predict what kind of surge we might see in different parts of the country, essentially important in terms of how we use our physical and human resources, but also what kinds of patterns of disease we might be anticipating given the different measures. And I guess the third important part, how might alleviating some of these measures impact our ability to control that curve or reduce the severity of future surges or future waves. So as much as I wish I could just give you a simple answer, there isn't one, but I will tell you that a lot of work is being done on that. I don't know if Dr. Tam has more that you want to add.
I think that's a good explanation, and really together with the other chief medical officers, we've been looking at planning different scenarios, but all of us recognize that right now, how you influence the trajectory of this pandemic absolutely is dependent on exactly what we're doing right now. So it's to act rapidly. Even when we don't have all the information, we must act as we are doing now. In some respects, as we strengthen our public health measures over the last weeks, it also took a little bit of time for Canadians to truly pick up this message about physical distancing. So a lot of these measures were taken, just ahead of this. And so we really want to make a massive effort, because the length of time you could be into this epidemic wave is all dependent on what we're doing right now. So, and scenario planning is actually quite simple on a piece of paper, because all you have to do is do a set of attack rates at the top, mild, moderate, severe on the other side, and give you a number. Is not that helpful for us right now, but we have been doing that exercise, and but we really want to focus our attention of getting this first wave under control. Let's just say that, just to add that, any planning scenario has us potentially overwhelming our healthcare system. So as I've said, part of the exercise so that you free up some of the hospital resources and ICUs, purchasing extra ventilators. But the really difficult message, I think, to Canadians is that on a whole range of these scenarios, this health system isn't well designed to cope with it if we don't do something about it now. So it doesn't matter which number you plug in, that's the truth of the matter. It is an extremely serious situation. You've seen how this is played out in certain areas of the United States. None of those scenarios are a good one. You've got to do something about it now.